Good afternoon, everyone, and welcome back to our regular daily 2:30 briefing. To kick off our conversation today, I'd like to call on Dr. Ezike for today's medical update.
Good afternoon, everyone, and hope people were able to celebrate the holiday that honors our nation's heroes, as well as maybe graduations, other special events in a MSD, masked and socially distanced kind of way. I want to mention that our numbers today, the cases, the deaths, the total specimens resulted are today, as they typically are on the weekends, a little bit lower, and that's because medical providers, local health departments, laboratories may not always report everything over weekends. And we were fortunate in our state public health labs to actually give them a day off for the first time in months. So we will see the numbers pick up again after starting tomorrow. But since yesterday, we had 1,178 individuals that were diagnosed with COVID-19. That brings our statewide total of confirmed cases to 113,195. This did still include the report of 39 additional individuals who lost their battle with COVID, for a total of 4,923 deaths. As of last night, and these are actual numbers not affected by the weekend, 3,788 people were in the hospital hospitalized with were hospitalized with COVID-19, and of those 3,788, 1,035 patients were in the ICU, and 590 individuals were on ventilators. To date, 794 tests have been run, with 17,230 being reported in the last 24 hours. I see my role as one to share data and also to share ways that the public can keep themselves safe, but I'd also like to share some hope. And I do want to share that for the week ending May 16th, we reported out a total of 780 deaths. While 780 deaths, of course, represent 780 individuals who lost their lives, and families and loved ones and communities who are mourning those deaths, it still signals the first week that there have been fewer deaths than the previous week. And so I am hopeful that this fact is the beginning of a downward trend. But of course, that also depends on all of us and making sure that we're doing all that we can to decrease the transmission of this virus. Another good thing is that remdesivir, that is the investigational drug that has showed some important clinical outcomes for hospitalized patients, and that it decreases hospital stay. We did get a third shipment of remdesivir last week, and that involves 353 cases, and that has been distributed to hospitals around the state. Each of these cases has enough vials to treat approximately 5 patients, depending on the course of treatment that's utilized, whether it's a 5-day treatment or a 10-day treatment. And I know hospitals want to know how we determined where that medicine went. We looked at several criteria. We analyzed COVID-19 data provided by hospitals, the number of COVID-19 patients, as well as bed and ventilator use. Every hospital with at least one laboratory confirmed or probable COVID-19 case using a hospital bed between May 12th and 18th received at least one case. The remaining cases of remdesivir were distributed proportionally among the hospitals based on the number of confirmed or probable COVID-19 cases in their hospitals during that same time frame. Hospitals that may not need the remdesivir that they were allocated are free to share their allocation with other hospitals that can use the medicine for their COVID-19 cases. We will not be getting any shipments of remdesivir this week, but we are expecting additional shipment next week. It is our intention to make sure that every hospital that's treating COVID patients receives at least a case of remdesivir. And so if you happen to be a hospital that did not receive a case, please call the COVID line and let us know that. We will make sure that with next week's shipment that you are included. We are trying to make sure that this touches every hospital that's participating in COVID care. So while early studies have shown good results, this is still an investigational drug. We're learning that there are other drugs that are in the pipeline. This drug did show decreased hospitalization days, and so we are happy to have received this from the federal government and are happy for our hospitals to be using this in the care of COVID patients. But until we have a definitive cure and a vaccine, we must continue to protect ourselves from the virus and prevent further spread. I thank Governor Pritzker for his constant call for action to aid the people of Illinois. His call and his support of hospitals has given our state a great position as we take on this fight against COVID-19. So as always, please stay home, wear a mask when you are not at home, and keep 6 feet of distance between you and others. Let's continue to keep up our fight against this pandemic. Thank you. And I will now summarize comments in Spanish. Buenas tardes y espero que disfrutaron el fin de semana en una manera saludable y con distanciamiento social. Quiero mencionar que nuestros números, los casos, muertes y muestras son típicamente más bajos los fines de semana y algunos proveedores médicos, departamentos de salud locales y laboratorios pueden no reportar durante el fin de semana, lo que significa que los números que vemos después del fin de semana son elevados. Desde ayer, 1,178 personas han sido diagnosticadas con COVID-19. Ahora tenemos 113,195 casos confirmados en total en Illinois. Lamentablemente, esto incluye 39 personas adicionales con COVID-19 que han perdido la vida para un total de 4,923 muertes. Hasta anoche se informó que 3,788 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,035 pacientes estaban en la unidad de cuidados intensivos y 590 pacientes estaban en ventiladores. 17,230 pruebas hechas fueron reportadas en las últimas 24 horas. Illinois recientemente recibió su tercer envío de 353 cajas de remdesivir y los ha distribuido a hospitales por todo el estado. Cada caja contiene suficiente medicina para tratar aproximadamente 5 pacientes, dependiendo en el curso del tratamiento. Hay algunos factores para determinar la distribución de remdesivir. Analizamos los datos de COVID-19 de los hospitales, el número de pacientes con COVID-19, también la disponibilidad de camas y ventiladores. Cada hospital con al menos un caso COVID-19 confirmado o probable por laboratorio que usa una cama de hospital en algún momento del 12 al 18 de mayo recibió al menos una caja de medicina. El restante de remdesivir se distribuyeron entre los hospitales en función del número de casos confirmados o probables de COVID-19 en sus hospitales durante ese mismo periodo de tiempo. Esperamos futuros envíos de remdesivir. Los primeros estudios han mostrado buenos resultados. Debemos recordar que este sigue siendo un medicamento en investigación. Hasta que tengamos tal tratamiento o vacuna, debemos continuar luchando contra el virus y evitar una mayor propagación. Agradezco al gobernador Pritzker por sus llamadas para acción y ayuda para el estado de Illinois. Su llamada para tratamientos y apoyo para nuestros hospitales le ha dado a nuestro estado una oportunidad de luchar contra este virus. Quédense en casa cuando puedan. Usa una máscara cuando no pueda mantener la distancia entre usted y los demás. Estos son los claves para enfrentar este virus. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Good afternoon, everyone. Again, over the weekend, my administration released our baseline health guidance for those industries that are eligible to begin their reopening in Phase 3 of Restore Illinois. While many individual businesses and specific associations have already developed more stringent guidance of their own, these protocols offer a minimum expectation of what operations should look like for these businesses moving forward. Anyone interested in reviewing this guidance or accessing business toolkits with signage and training materials can find them on the Illinois Department of Commerce and Economic Opportunity website. With that in mind, I want to briefly review where each region of Illinois stands in meeting the metrics to move into Phase 3 this Friday, and the overall direction of those metrics for our entire state. Phase 3 of our plan began May 1st, and especially over the course of the past 2 weeks, we have all watched the trends of each of the 4 Restore Illinois regions and measured them for the 3 metrics necessary to move forward: positivity rate below 20%, stable hospitalizations, and hospital bed availability above 14%. There is great news. All regions continue on track to move into Phase 3 by the end of this week. Statewide, the positivity rate, which hit a high of 23% in late April, is now averaging 9.2% for the last 7 days. COVID-related hospitalizations, which had been holding steady a couple of weeks ago, have now dropped to a 6-week low, with nearly 1,200 fewer beds in use by COVID-positive patients. And hospital bed and ICU bed availability are both above 30%. So as we look at each individual region, you see the same trends playing out everywhere. Instead of reviewing each individual region for you again today, all of the data for every region, which is updated each afternoon, can be found at dph.illinois.gov/restore. Again, that's at the Department of Public Health's website, dph.illinois.gov/restore. The fact that we've seen these numbers trend in a good direction, even after we opened things up in Phase 2, demonstrates the importance of everyday actions. Remember that one of the biggest mitigation measures was put in place at the same moment that we opened more things up. We required face coverings. Take note that along with social distancing, face coverings can make all the difference in protecting each other. And it appears to be working. Since we implemented that one change, we saw all the numbers that had already stabilized then begin to fall. A gradual restoration of more areas of our lives, together with the basic mitigations like social distancing, face coverings, and hand washing, taking greater care to consider public health in all that we do, are the keys to moving quickly through the phases of Restore Illinois. As always, all of our success thus far, and any that we have going forward, is dependent on the actions of each individual and all of us collectively to protect each other. Thank you, and now I'd be happy to take any questions from members of the media. Craig?
Good afternoon, Governor. Nice to see you again.
Good to see you.
Does it feel good to be back in your offices?
Well, I mean, it was great to be in my office in Springfield, that's for sure.
Quick question. The last time we were here was prior to the announcement of your staffer who was diagnosed. Can you give us a quick update on how that person is doing?
That person is fully recovered. That person is back at work and doing just fine. So thank you for asking.
I have a list of questions here. A lot of them have to do with Alan Skillicorn this morning announcing that he was going to be going ahead with a recall. Affidavit for you claiming you failed the state with IDES and you've overstepped your authority. Can you respond to that affidavit, first of all?
Well, I'm glad to hear that the representative apparently has changed his mind and now believes that we ought to fund state government instead of hollow it out the way that he has voted over the course of his career, because it is a fact that IDES and other agencies like the Department of Public Health have been, frankly, left behind after many years of representatives like that one voting to have a budget stalemate for 2 years in which we had no budget and no funding for our budget in the state, and has consistently voted against budgets that would fund vital agencies that we now, frankly, need very badly in this pandemic.
He's saying you were late to the ball game to respond and prepare for, knowing that your stay-at-home order was going to cause millions of people to be called not essential and to lose their jobs. He said more should have been done sooner. How much of this problem do you bear responsibility for?
Well, I think what he forgets is that the stay-at-home order, which is very much like what's happened all across the nation, was a vitally important part of slowing down the transmission levels of COVID-19. Many, many fewer people have died. Many, many fewer people have gone into ICU beds or hospital beds than would have had we not acted quickly at the beginning. And in the middle of this, remember what Emily Landon, the doctor who stood here on the day that we put the stay-at-home order in place, said, which is, the consequence of all the work that we did is nothing will happen. And so, yeah, I understand his point. His point is that now that you see things, I assume that he wanted the stay-at-home order at the beginning, although he never has expressed that.
I think what he said today was, in effect, that you should have anticipated so many people were going to be filing for unemployment, should have done more with the website sooner, should have hired more people sooner to deal with what he says you should have anticipated was going to happen.
Well, you couldn't possibly anticipate that we would have a number of unemployment filings that was an enormous multiple of that which occurred during the Great Recession. Nobody expected that. Nobody knew, in fact, when this pandemic would begin to subside in any way. In fact, the pandemic itself has not, but the reaction of the people of Illinois has really kept people safe. So the IDES website was designed 10 years ago. We've talked about this. And of course, when it became clear that we were going to see a rush of applications, we acted as quickly as we could with a system that, frankly, you can't just snap your fingers and replace. You have to, as I have often said, you're building the plane while trying to fly it. And you're trying to fly it while putting 1 million passengers on board. An almost impossible job, but one that IDES has handled as best it could. Now, the number of people who man the phones, I have to say that there are federal requirements for the training of somebody who answers a phone because of the privacy considerations. And so we've only been able to grow that very modestly. We brought everybody that we could to the front line to answer phones. We've expanded the number of phone lines, put new systems in, so people are getting their calls answered at about the clip of 2,000 per day. And we continue to work very, very hard to respond to people who could not get their application filed online. But again, I want to say to anybody out there that has not filed for unemployment, that needs to file for unemployment, that your best bet is to go online. That system is now handling many multiples of what it could handle at the very beginning of this epidemic. And I want people to make sure that they get the unemployment benefits that they deserve.
My colleague Mary Ann Ahern followed up with that. Do you need to hire more people on the phone lines? In New York, they got help from Google to get their site up and running. Do more people need to be hired for the phone lines? And should another company be brought in to help with the computer system?
Well, as with New York, we brought in outside contractors as well, and that's why our systems are working so much better now than they were at the very beginning. And so I want to compliment the people at IDES working with outside contractors to expand that online capability. As I said just a moment ago, we're bringing people on as fast as we can, but again, with the requirements for, the federal government puts on who can be on those phone lines, really managing incoming filings. What we've done is tried to offload the calls that aren't individual privacy consideration calls and try to either put them to people who are not trained at taking by the at federal government level to taking those filings. So they can take the kind of helpline sorts of calls, or when people go online, they now have the ability to speak with somebody online on a chat bot.
Over the weekend, first of all, so many people were out and about. My colleague Sarah Schulte is asking about this Memorial Day weekend. First of all, were you in Lake Geneva at all? And if not, did you at least see the video of all the people that crowded the streets around the lake there, as well as the Indiana Dunes? And what's your reaction to so many people? Most of these people are probably coming from Illinois, just ignoring all the social distancing we're doing here, going to these other states, and then coming back.
Yep. Well, the answer to the first part of that question is I think you've seen me every day on camera with this backdrop or in Springfield for the last 75 days or so. I have not been out of this state for, I don't know, since before, sometime in very early March, before this pandemic hit, before we had a disaster declared in the state. So that's the answer to the first part of that question. In terms of people who are going and partying in, not wearing masks, leaving the state, doing things that are essentially against the rules here in Illinois, but okay in some other state. I just want to point out that I just read yesterday that there was a 16% increase in hospitalizations in the state of Wisconsin since the stay-at-home order was rejected by their Supreme Court, and a 30% increase in Milwaukee in hospitalizations. So I think that's an example of what can happen if people don't follow the mitigations that are supposed to be put in place, that are supposed to keep people healthy and safe. So I would caution people, look, nobody stopped anybody from traveling. That's never been the case. Anybody can travel. What we've suggested to Illinois residents, because we want Illinois residents to be safe, is to follow the same rules for yourself when you travel that you would have if you were at home.
Were you dismayed, though, to see these crowds like they were?
I am terribly dismayed, frankly. I think that, the challenge here is I want every resident of Illinois safe. I want them to keep themselves safe. They have the ability to do that. And so people who choose not to either haven't been reading the newspaper, aren't following the rules, don't seem to understand how dangerous this pandemic is. And I want to be clear to everybody that's watching and to all the reporters so that you can report it out. The pandemic is still here. Just because the numbers are moving in the right direction in the state of Illinois, that does not mean that the virus has gone away. It's still there. The reason that we're doing so much better here in Illinois than we would otherwise have is because people have worn face coverings, that people are washing their hands. They're doing the things to keep themselves safe that they should be doing and following the executive orders that I put in place.
Cisco Cotto with BBM Radio asked, some Illinois houses of worship have capacities of hundreds or even thousands. California is letting them reopen with capacity limits this weekend as long as they don't have more than 100 people at a time. Yeah. In which phase do you plan to allow houses of worship to be able to do the same? And to that point, have you asked IDPH to come up with guidelines for churches for when they could open?
We've done even more than that, Craig. We've asked churches to come with their ideas about how they can do it safely. As you've seen, we have allowed drive-up services. We are working with churches for outdoor services. We want people to be able to worship. I think it's vitally important. All we want to make sure is that when they do it, that they're safe. And so we'll work with any. We're taking plans from churches and trying to work with them. You saw that the Catholic Church came up with a very workable plan that I think is, a model for people to follow. So I encourage anybody that has an interest in putting forward to do it safely, because I know just
Good afternoon, everyone. Good to see everybody back. I hope everybody had a good weekend, a little time at home, and got to spend a little time with family and friends. All right, first of all, let me start off. I know there's been a lot of news this weekend about the Lake of the Ozarks, so we might as well address that right off the bat. Unfortunately, there were some poor decisions that were made, and the social distancing was not followed, as we all know. And I think it's important when social distancing is not followed, as it's potentially dangerous for everyone, especially our most at-risk individuals. A lot of those people was down at the lake. They're going to go down there. People have been shut up for a long time and wanted to get out and be down at the lake. But the problem is everybody's going back home. Everybody's going back to different districts, different towns and everything, which kind of complicated the issue to say the least. But I think that said, the Lake of Ozarks is a small sample of Missouri. While poor choices were made by some at the lake, there were many other Missourians across the state who did make safe and responsible choices over the holiday weekend. And I got to firsthand see that at my granddaughter's high school graduation, Sparta, on Thursday night, where social distancing was practiced, all the way from the students to the families that came there and for the school itself. On Sunday, I attended church back home. Again, they have accommodated to get people back into church by having 3 different services on Sunday morning. Again, people were escorted in and out of the church so nobody could congregate in the common areas. And everybody was separated by pews and when we went to church. So I'm proud of my church for doing their part to do that, along with many of the other churches that started this weekend. Overall, we have witnessed responsible practice by our citizens, and these efforts have made a positive difference in our entire state. We know that many people are excited about the progress that we have made during the reopening, whether it be your church, your favorite restaurant, your businesses, sporting events, or whatever else you are eager to get back to. The sum of all of these places and things is our Missouri. And we must remember that it is about a cause much bigger than ourselves. We have taken positive steps to move Missouri forward, and we must all continue to practice the recommendations that will keep our state headed in a safe and healthy direction. Today, we also had some good news about business expansions in Missouri. As we continue to move forward with reopening our economy, 2 companies have decided to expand in Missouri. Farm Foods and Nordstrom Laboratories are expanding in Missouri's Hunt Midwest subtropolis, a 55,000 square foot mandated limestone cave that has been renovated into an underground business complex, offering a safe and secure location for companies to grow. These announcements are another example of the positive things happening in our state and show that even the aftermath of COVID-19, Missouri is still a top location for business expansions. I also want to remind everybody on the economy, as I've seen these 2 businesses expand and the growth, the possibilities of that happening again, just keep in mind 3 or 4 months ago, our economy was rolling here in this state. We had business expansions across this state. We had businesses coming here from other states, from other countries to expand. There is no reason we can't pick that up where we lost. Every other state's going through what we're going through, but the competition will still be out there to grow the economy and grow businesses. And Missouri has every opportunity to lead again in those very aspects of moving our state forward. You know, time's going to take care of this COVID-19, but again, to get our economy going, we got to be prepared, and Missouri is going to be a good place for business to come and to expand, and we're going to make sure we're ready for that day when that comes. Another recent topic of concern has been Medicaid expansion, and when will it be placed on the ballot? Today, I made the decision to place Medicaid expansion on the August primary ballot. And I want to be clear about this was about policy, not politics. At a time when our state is undergoing a major health, economic, and budget crisis, we need to know exactly where we stand when it comes to a massive spending initiative for Missouri. Our government is working day and night to make the best decisions for the people of this state. And to make those decisions, we need to know as much information as soon as possible. Missouri is already one of the top 5 states in the United States for general revenue spending on Medicaid. and are estimating we will need an additional $88 million in general revenue through 2021 because of the COVID-19. So pass or fail, it is important that we understand the implications of what would be a new spending bill out of our already depleted general revenue. I think in comparison, when you look at initiative petitions, if you compare the Medicaid expansion to the conservation, to the transportation, to MoDOTs and their funding sources, or recently as medical marijuana, all of those had funding sources attached to them. Medicaid expansion does not, and it will depend on general revenue. That will compete against DESE. It will compete against higher education. It will compete against mental health and public safety. All of those things are a reality, whether you support or whether you don't. The reality of it is it will compete for general revenue dollars. There is no new funding to go along with that. It is important, as we know where we're at on the economy now and what we're facing going into 2021. Again, I want to say the reason we put in August, the sooner we know where we're at, whether we have to deal with it or whether we don't, we need to prepare for that for the budget of the state of Missouri on that. Missourians will determine the outcome, and it is critical that we hear their decision as soon as possible, which is why we are placing it on the August ballot. This will give us more time to account for the outcome in our state budget. Last week, I announced a plan to rapidly increase testing volume in the state of Missouri with a goal of reaching 7,500 tests per day. Just to recap, the plan includes 3 main testing strategies: box-in outbreaks, Sentinel testing, and community sampling. Even over the holiday weekend, we made some good progress on testing, and we will continue to take even more aggressive actions throughout this week and next week. I know there has been some things out there about Memorial Day weekend increases. I want to point out that the new positive cases over the weekend are not necessarily a direct reflection of Memorial Day. As I have said many times, our actions today will have an impact days and weeks from now. So much of what took place over Memorial Day weekend will be seen in future data. Let me say this and stress this again. Last week, when we come out and we rolled out this plan, it was to do more testing and more testing. The positive numbers are going to go up because we are ramping up our testing, which will happen. I know I read a recent article, and I'm not even sure where it came from, but it was about talking about Memorial Weekend positive spikes. Anything you've seen as far as the spike would have been tests from last week. There was no immediate returns over Memorial Day weekend. You won't see the results of Memorial Day weekend until probably 5 to 10 days down the road. So it's important for people back home to understand that when we report that information. Quest, and I think Dr. Williams is here today, he's going to touch on that too. But for Quest, for example, they're 7 days behind. So eventually they're going to kick all our tests in on the 7th day, let's just take for example, and those tests are going to go up, and it's going to look like a high positive spike, but it's simply because you get all that data in one day. I think it's important that people know that, and all of you here today have that opportunity to kind of explain that the best you can to people, because we get way too concerned about the positive number, which is really, without doing the healthcare side of it, without doing the hospitalization side of it, is really somewhat misleading to the people out there to know. What we should be really taking a really good look at is what we've seen over the weekend is hospitalization went down by a large number, and you can get that number off the site. Those are how we're moving the economy forward and how we're making decisions. So again, I just want to stress to you, testing, the more we do, the more tests, there's going to be a time delay on when we get those results. So there is going to be spikes in that. So I think it's important for people to understand that and to know that. And again, the more testing we do, the more positive cases there will be. But this does not mean there has been a surge or that our healthcare system is overwhelmed. Our hospitals are still in good shape, and we continue to monitor this on a daily basis. And today, we started community testing in Jackson and St. Charles counties, and we'll be testing in Boone, Cape Girardeau, Greene, and Jefferson counties next week. Any Missouri residents who would like to be tested for COVID-19 can do so at these sites at no cost. Missouri residence is the only requirement. You do not have to live in the county offering community testing or be experiencing symptoms. Also today, Sentinel testing will begin taking place in all Missouri Department of Corrections adult institutions. Director Pritzker is here today to give us an update on that, but before I bring her up here, I just want to brag on her, and I want to talk about the Department of Corrections for the job they've done in their state. One of the most highest risk institutions that we all know going across the United States we were all concerned about early on. And thank goodness for her leadership. Thanks goodness for the people that work there every day on those front lines. And thanks for them coming to work every day, when it would have been much easier for them maybe not to come in because of the risk and the fear they had, but they continue to support this state and continue to take care of business like they should. And I appreciate all of those guards that are out there, the administration and the director for what they've done. And thank goodness our state is in the shape it is today, and it's to her leadership. So with that, Ann.
Thank you, Governor. Sentinel testing in Missouri is important for the road to recovery for the community, but it's also important for the road to recovery for corrections. We have all had to modify various routines to accommodate the uncertainty of this pandemic. In order to resume some sense of normalcy in corrections, which includes things like inmate transfers and family visitation, it is incumbent upon us to participate in Sentinel testing. This is important to both the governor and me. We now have the necessary number of supplies to be able to meet the needs for testing our entire division of adult institutions, staff and offender population, which is approximately 32,000 people. To accomplish this, in addition to already testing symptomatic offenders and those who have been exposed to the virus, the department is developing a comprehensive Sentinel testing plan for staff, contract staff, and offenders. Phase 1 includes testing 3,500 staff and offenders at 2 facilities over a 4-day period. Phase 2 includes testing 2,900 staff and offenders at 2 facilities over another 4-day period. And we will make adjustments to Phase 2 based on what we learned from Phase 1. The initial sites selected for Phase 1 are Southeast Correctional Center in Charleston, Missouri, and South Central Correctional Center in Licking. Both facilities are maximum security prisons with the ability to further limit movement if needed and adjust quickly to any staffing changes that may occur. Sites selected for Phase 2 are our women's prison in Chillicothe and a minimum security prison in Jefferson City, Algoa Correctional Center. So lessons learned and data collected from these 4 locations will enable us to refine and adjust our processes as we continue testing other prison sites across the state. I'd like to thank the Missouri National Guard for assisting us with this process. They, along with members of DOC, were at both sites this morning at 5 a.m. and they began testing at 6 a.m. Everyone was properly fitted for N95 masks and PPE. We'll run 2 8-hour shifts with 5 National Guard medics and 1 employee health nurse testing staff. And then following testing staff, the National Guard medics will go inside the facility to assist our contract health care providers with offender testing. And this will continue over the next 4 days. Our target number is to test 875 individuals per institution per day. Test specimens will be transported to the testing lab multiple times daily, and results will be returned in 24 hours. From the beginning of this health crisis, the department has been conducting tests on all symptomatic offenders throughout the state. We've been screening all new offenders at intake and testing and isolating those with symptoms. Now, with sufficient testing supplies, we'll be able to test all new arrivals at intake. We've been screening all offenders prior to release. And now, with the additional supplies, we will be able to test everyone 1 week prior to their release from prison. I continue to remind staff, offenders, and others, it is important for all Missourians to understand testing is not something we're doing Testing is something we are doing for you, not to you. We are finally in the position in Missouri where we have the ability to test large numbers. This pandemic has repeatedly caused us to say we don't know what we don't know, but the only way to know for sure is to do testing. And we need to test as many people as possible. I want staff to know with confidence if they are negative. And I believe this approach will begin to give people confidence as they not only come to work, but as they go home to their families. And with that, I'll take any questions. Oh, sorry, Governor. We'll let the governor take questions.
You'll be back, and we'll get you back. They'll have some for you, I guarantee you. Let me just finish up, and again, I just want to thank the director, for all my directors have just been outstanding during this entire time. But let me just say again and again, I'm going to keep repeating this till I feel like we've got the mission accomplished. Testing is the key to Missouri's full recovery. In order to restore consumer confidence and bring back our economy, we must significantly increase our testing numbers. This also goes along with getting schools back started this fall to make sure we're prepared for that, whether it's the universities or whether it's the elementary schools, K through 12, we got to get ready for that. More tests means more data, which gives us a clearer grasp on the situation in Missouri and more reassurance of the people of our state that is key and okay to move forward. That said, I want to remind all Missourians to continue to be safe, to be smart, and be proactive. Even though things are improving, this virus is not gone. We must continue taking steps to protect ourselves and everyone around us. So with that, thank you all for being in today. God bless. Kelly, let's open up question. Director is wanting to get up here. Let's get her back up here to answer questions. Director?
Oh, none?
Director Pritzker, Crystal Thomas with the Kansas City Star. So for the facilities that you listed, did you list the St. Joseph Correctional Center?
Not at this time. We're starting with Southeast Correctional, South Central Correctional, Algoa, and Chillicothe next week. I have a team back at the office right now as we speak that is developing the plan for the next few weeks so that we can determine where to go next.
St. Joseph Correctional is where an inmate died. Is there a reason why it's not first on the list?
We have not had additional positives from that location. We've started with institutions that, with Southeast, we might as well go ahead and test the whole facility there. Right now, we've tested currently one housing unit, 3 wings had negative offenders, 1 wing, where our first positive offender at Southeast came from is the wing that had the additional positives. We've tested 614 offender tests, and we've had 44 positive offenders, all of which have been at Southeast Correctional.
And how many guards have tested positive for COVID?
We've tested correctional officers. I don't have that number. We've tested over 265 staff, 14 of which have tested positive total across the state so far.
All right, thank you, Director Pritzker. Dr. Williams?
This really could be for Dr. Williams or even Governor Parson again when he comes back up to the podium. But seeing those videos and photos from the Lake of the Ozarks this weekend, you see hundreds of people in pools at several different businesses.
Yeah.
Most of these people are from out of town, except obviously the people that work at these businesses.
Right.
Obviously, there's a concern there with transmission of this virus spread to them. Is there any planning on having testing done in Camden County, Miller County, around the Tri-County region of the Lake of the Ozarks to make sure that those people that are working in this environment don't contract COVID?
It's a good point. Obviously, you saw my press release yesterday. It saddens me to see that because we've done so well here in Missouri to date, and the credit for that goes to Missourians for getting us to where we are. We're in the 4th week of opening back up, and today I think we had 121 cases. Yeah, as you know, has been pointed out, and the governor pointed out, many of those people we think traveled there, and now they're traveling back. And you've heard Sam Page and Lyda Crewson talk about that, and even Quentin Lucas in Kansas City talk about that. The problems that creates. It's very different than hairdressers, in which they kept a very detailed record of who they were around. We can do contact tracing on that, but when it comes to the pictures you saw, it's very, very difficult to do that. Again, that authority rests with the locals, so we will work with them, to your point, to see if we need to, given that kind of massive exposure, if we need to do in more testing in Lake of the Ozarks and in those counties. So we'll start that process now. But just going forward, just would highly encourage people to practice social distancing. Just because you're outdoors, you still need to be 6 feet away. We think it's great to be outdoors, but you still need to practice social distancing. So as we go into the next weekend and the weekends after that, and we have warm weather and people are more outside, we just really don't want to backslide here. When I look at other states who haven't even peaked yet, and our peak was April 7th, we've done so well. When I was a physician, you'd prescribe an antibiotic for 7 days, and people would take 2 days and quit, say they felt better. And they wouldn't take the extra 5 days. Well, there's a reason we were giving it for 7 days, is that we knew that that's how long it took to knock out the respiratory tract infection or meningitis or whatever. So when they quit taking it, they'd come back sicker than they were the first time. And so by that analogy, we don't want people to quit the prescription we've given them. They need to go the full course, which is continued social distancing, no matter where you are.
Director Williams?
Yes.
So the governor earlier had said that he wants to avoid any misleading representation of state testing data.
Yeah.
Speaking of misleading, last week you said that the state was not including antibody testing in the overall testing. You said that repeatedly.
Yes.
So I guess I'd like to ask, did you intentionally lie to Missourians about that, or did you not know what was going on in your department with testing?
Yeah, thank you for letting me clarify that, and the answer is no, I did not know we were doing that. So, as you remember, on January 27th, we put out an order saying that COVID-19 was a reportable disease. And consistent with our Bureau of Reportable Disease and Informatics, that included serology and PCR testing. Now, serology, I think the first serological test we ever did in Missouri was on April 4th. And we had been doing PCR testing since late February, with our first positive on March 7th. And so I made it very clear to our staff that having practiced medicine for 30 years, we could not conflate the two, that they're two very different things that we're looking at. And that message was heard and received, I thought. And then on Wednesday, I reported out how many serological testing we'd done, because we try to be as transparent as we possibly can. And I think I reported to you we'd done about 12,000 tests, and we'd had, I said 200 something, but it was about 400 been positive. Well, after I said that on, I guess I said that on Wednesday, on Thursday, we had a tremendous amount of tests come in of testing. And when I looked at the numbers, I thought, we've started this very aggressive testing, but we haven't started it yet. Where are these numbers coming from? And at the same time I was doing that, I got the call from our staff that, in fact, unbeknownst to me and the lab and the senior leadership team, the CDC had directed us to report serological testing and the PCR testing together. And we had staffers who did just that. And we've spent all weekend investigating it, and they did as they were directed. Now, it's a national story. The CDC has said they shouldn't have done that. They wish they hadn't done it. And as soon as we knew it, we went back and spent all weekend backing out the data to distinguish, and it's on our website now. You can see how many serological tests we've done. You can see when we've done them. You can see that the vast majority of those have been since May 11th. We've done 11,000, I think, of the 18,000 tests in the last 2 weeks, because now people are getting serological testing. It wasn't even available in March. So am I frustrated that the directive that I thought was pretty clarity did not happen? Yes, I am. But when I talk to the people, I have to be gracious in that they had talked to the CDC. I've seen the communication. They were told to do that. The CDC has now said they shouldn't have done that. And so for here in Missouri, we've corrected it. So I hope that answers your question. I want to parenthetically add to that, though. I've seen some reports in two different media things that there were cases here in February that were not reported. Let me make it very clear. Our first test positive here was on March 7th. I remember it well. The governor and I were together in St. Louis for that. But as part of our reporting, we asked people when they were symptomatic. And if they say, by golly, I was symptomatic on February 2nd, we enter that information. Not that they tested positive on February 2nd. Now, I would argue that somebody who tested positive on March the 12th and says they were symptomatic for 6 weeks, that probably wasn't COVID-19. But we put down what they say. So let me just be real clear for two media outlets here. We have no evidence that people were positive on February 4th or February 12th. We just presented to you that they said that they were symptomatic that far back. But the first case of tested reportable positive COVID-19 was on March 7th.
So regardless, a follow-up question.
Yes.
Summer, you can ask your question.
Regardless of why the miscommunication occurred with the antibody testing,
Right.
how do you expect to earn back Missourians' trust that the data that you're providing about this pandemic is accurate?
Yeah, I think that what we try to do is in any novel emerging disease, when the CDC, which is the world thought leader, is feeling its way along this on how to report the data, that all of us have to be very humble and say that we will constantly learn. Just to give you another example, we this weekend also added to our website going forward. You know, the governor always says to get better. We were reporting positive tests of people who were doing test of cures. So it looked like there were 100 cases. Well, there might have been 90 cases, but 10 of those people were getting tested 2 or 3 times. And so going forward, as we move into this second phase, this recovery phase, we are backing that out so that now we're trying to identify not only separating the serological cases, but to give you and everyone else a true picture of how many people have tested positive as opposed to how many tests have been positive. Because now that we've been doing this long enough, we've seen that this wasn't an issue back in March because we weren't doing test of cures, but now we are, and we don't want somebody who's had 4 tests to be reported as 4 different cases, if that helps. So I guess what I would ask of the people in Missouri is to say that we are doing our very best to robustly put out the data that in any novel emerging disease, we will learn as we go along and get better and change it. I appreciate their patience in that. I guess my commitment is that as we learn, we will share it, we try to post it, and then we're here to be accountable, which I think is incredibly important to your questions, and answer why what happened or why we did what we did. But let me be very clear. My senior leadership team did not know that we were combining serological testing.
Thank you.
You're welcome.
Director Williams,
Yes.
you mentioned that patients reported that they were symptomatic as soon as February 2nd. At what point did the department know this information, and why wasn't shared publicly before this weekend?
I think, Crystal, I think it was part of updating the dashboard that when we put out the serological testing separately, that was part of the information that we put out. Now, I don't want to be to mischaracterize anything. If you said to me, Randall, I think there were positive patients before March 7th in Missouri, I think we learned from Washington State that's probably true. I don't think that particular patient who came back from overseas was maybe the first patient. It's the first documented case we had. But, you know, I think all of us would understand that there may have been a patient who came in from Germany or wherever who was mildly symptomatic or even asymptomatic. So I don't want to represent to you that we absolutely know this was the very first patient. It's the very first reportable patient. But I just want to clarify the February numbers I've seen in 2 articles are just based on symptoms. We don't have test results that showed that they were truly positive on February 4th.
So, but at what point, though, did the department know that information?
I don't know the exact date, but I do know that when we decided to put the serological testing, we decided to share that as well. So I can't answer exactly what date that information was collected.
Was that information shared with?
Yeah.
Did the department share that information with any municipalities or local health departments that were looking to make decisions about big events in their area?
Well, I don't know exactly when we knew that, but I don't think it's I think it was a very limited number of patients that have reported symptoms back, as I remember. A dozen. And so I don't know that would significantly affect their decisions. Again, for the serological testing, it's real important to understand that of the 18,000 or so that have been positive, I think 11,000 of those are since May 11th. And when we were making decisions in March and April, we were not doing any great degree of serological testing. I think in the first 10 days that we were doing, I think we did like 25 tests or 30. It's only been in the last 2 weeks that it has significantly changed our numbers. Thank you.
Thank you, Dr. Williams. Governor Parson?
Now, let me just make a comment on that situation. That's just, well, let me just say this. Nobody knows when the coronavirus started in Missouri. Anybody with any common sense would know that, because we know only when the first case was reported that we analyzed. To try to make a story out of who had it before that date and trying to figure out who it was and when it happened, nobody knows when the first case come here to Missouri, and nobody's going to know because it come from a different area, somebody traveled here. So, I mean, to keep kind of beating this horse to death here, you know, I mean, I don't even understand where you're going with it, other you're trying to make a story out of something that somebody doesn't have the answer to what you're wanting. And to me, it's just a poor article to start off with. But anyhow,
Governor,
let's open up questions on that. Kelly?
Governor, do you think it's important for the Missouri public to know the full picture of when tests happen?
I think
when
one of the most
cases are
important things
reported?
we can do for the public is to be transparent, me and you included. We should tell the people the truth and make sure and let them decide whether it is or not. I'm going to tell you again, nobody knew when the first case come to the state of Missouri. Nobody knows that. All we know is the first active reported case. That's what we reported. Now, what they had contact before, after we found that out, we did start going back for that information at the time. But we don't know that, and you keep kind of wanting to ask that same question over and over again like we've not told the public something. We've been up front with the public yet, so I've answered that question. Thank you. Next question.
Which are the data points.
Thank you, Crystal. Next.
We-
Andrew, do you have a question? I do. Okay, go ahead.
Going back to the Lake of the Ozarks situation from this weekend, are you looking into these businesses? I know your phase one of the plan kind of set capacity guidelines for a lot of different places. People say that pools and chlorine kill the virus. Are you looking into these pool bar businesses at all, and have you talked to them or talked to the health department in Camden County?
My office hasn't personally. We haven't reached out to them to talk to them at that point. I mean, there's going to be follow-up to the Department of Health. I mean, I think one of the other questions that come up for Dr. Williams, I think, was, are we going to do more testing with Miller and Camden County? Look, we've told everybody early on we want to test everybody we can. So if that means going back there and testing all the employees, we're going to do it. And how are we going to handle this situation moving forward with the owners? We're just going to have to sit down and have that conversation. You know, again, none of us wanted to happen what happened at Lake of the Ozarks. I mean, I think that would tell us all. You know, we just assumed Missouri wasn't on national news for that, but the reality of it was we were. So now we have to deal with the situation. We're going to have to figure out how we move forward with that.
Governor, for Lake of the Ozarks, which agency is responsible for enforcing social distancing orders if businesses refuse to?
I've answered that multiple times. I'll answer it again. It's the local levels, the local health departments are the ones in charge of that. And I've answered that question I don't know how many times since I've been doing interviews.
Based on that executive order, it says both the state and local health departments have the authority to enforce the 6-foot social distancing. If local agencies aren't enforcing that, what is your administration going to do to ensure people are following that 6-foot distancing order?
Well, look, you can't send somebody out with every person in the state of Missouri to make sure they're staying 6 foot apart. I mean, it's not even practical to do that. And I am not going to send the National Guard, I'm not going to send the Highway Patrol out to monitor this. That's just not going to happen. What the action is, the health department would go to the courts, and then they would file a petition in the courts for an action against that business or whoever's violating, just like you would any other health order. Whether you're going to shut down a restaurant, whether you're going to, if there's violations of health orders or for people's safety. They have that opportunity to do that.
That's the local health department's responsibility to bring those cases?
That's correct.
Do you recommend local health departments bring those cases where businesses haven't enforced social distancing?
Do I recommend that?
Mm-hmm.
Is that what you're asking me?
Yes.
We've made an order to that effect. It's in the state of Missouri. And we've had that order in place, I don't know, for months now.
So what
Same
you're
order
saying-
from the beginning when we started out in March. Look, it's the same question that has come up numerous times. It's to the local levels, to the local health departments to go. There's an action they take through the courts if they want to get something done. That's the answer to your question.
So just to clarify, you're saying,
Look, let me just say this. Yeah, let's move around, let some of the rest of them ask questions. We've asked about 10 questions here already. Yeah, go ahead.
Some Republican governors have offered their states to President Trump recently in case he decides to move the Republican National Convention from North Carolina. Have you had any discussions with the administration about Missouri possibly taking that place?
I have not with the administration, but if they called and asked, I would consider it. If they call, but I don't know if they've called and asked that or not. I'm not aware of it if they have. But I think Kansas City, be careful, but I think Kansas City actually applied for that or tried to get that convention to be here in Missouri. I think either they're St. Louis, but I'm not for sure about that, so don't hold me to that. But I think one of the bigger cities was trying to get for that at the time. They were competing for it.
Just had another kind of follow-up to the lake situation. So would you want these local agencies to file these things against these bars that weren't practicing the social distancing or enforcing that?
Yeah. Look, I don't, as the governor of the state of Missouri, don't want to get on the issue of the local issues. What they decide to do on the local levels is up to them. That's their businesses there. That's their people there. Their economy depends on a lot of that. That's got to be a decision people back there make. Back home, I want to say, make those decisions on that. I trust the people in those positions. Look, elected officials, whether it's the city mayors, whether it's the county commissioners, wherever you want to go, these people are elected to do these positions. I don't like the federal government coming in here and telling me what to do on a continuing basis, nor do I think the state should be down there telling the local levels what to do on a daily basis. Again, that's why those people get elected, and sometimes, you're in tough situations. You got to make decisions, and I think they'll make the right decisions.
One more question for you. If there does happen to be a spike among locals down at the Lake of the Ozarks, obviously that's a hypothetical at this point, but does the Department of Health have any sort of idea on how to move forward with that?
Well, we'd do it like we would do whether it's any other place. We'd do the box-in strategy, and we'd go down there and we'd start testing people if we've seen a little bit of an outbreak on that, which we could. I think the bigger concern is, of course, you want to take care of the people, but where'd all the people go to that were down there? I think that's it. And what do they do for a living? What's their profession? So, I will go back to what we said earlier. Even for the people that were down there, the one thing we've said all along, now is today, that we said a week ago that we couldn't say now. If you need a test, you can get a test. So I would hope some of them would take it upon themselves to go get tests, upon yourself to do that. But again, we can't regulate everybody to do that. You got to be able to have that self-responsibility that I've talked about from the beginning to be able to do that, to do the tests and everything. Thanks, everybody, for being here today. Thank you.